We begin a press conference by Prime Minister Suga. First, we hear what the Prime Minister has to say to us. Floor is yours, Prime Minister. Shortly before, we had a novel coronavirus response headquarters. And we discussed that the Hokkaido, Tokyo, Aichi, Kyoto, Osaka, Hyogo, Okayama, Hiroshima, and Fukuoka prefectures. And we discussed that to extend the state of emergency of those prefectures up to the 20th of June. On top of that, Saitama, Chiba, Kanagawa, Gifu, Mie prefectures. We discussed those prefectures. And we will extend the priority measures of those prefectures up until the 20th of June as well. New infections across Japan started to decline on balance. Some regions, however, are seeing the surge of infections and the situation is on the knife edge. In Kansai region, number of infections started to drop. However, Osaka and Hyogo prefectures are the center of overwhelmed the medical readiness, and they were still in a tight spot. In the metropolitan area, number of infections stayed quite the same and started to decline. But looking at Tokyo, still, we stand at stage 4. And other prefectures under state of emergency declaration still see the high level of infections. The number of criticals across Japan and the number of deaths still remains at high levels. Against this backdrop, we made a call to extend the state of emergency up until the 20th of June. The variant threat is something we need to pay attention to. So-called UK variants accounts for over 80% across Japan, and so-called Indian variants, that's something that we identify for people who haven't been overseas, and this has been said to be more transmissible, and there is more replacement of those variants. Up until the countermeasures started to take hold of declining infections, it takes more time. It was used to be by the end of this month to end the state of emergency, and we have gained cooperation from everyone and having taken various measures. As a result of that, new infections started to decrease, but I have to say we're not in a situation where we can lift the state of emergency declaration. We need to focus on accelerating vaccination program, and at the same time we need to roll out any precautionary measures against this COVID-19. On a repeated basis, we have extended the state of emergency, and we feel pains for doing it, but additional 3 weeks ahead, we need to contain outbreak as well as expedite the vaccination rollouts. These are the two aspects of the strategies we need to go all in, and the next 3 weeks will be the critical moments, we believe. We would like to gain your understanding and cooperation for what we are going to roll out. The specific countermeasures against the COVID-19, we would like to continue to work with each local governments to shorten business operations for restaurants and bars, and alcoholic and karaoke services will be suspended. And these are the strong requests from the government of Japan. So far, in scenes or moments of of taking dinners and alcohol beverages. And this is an area we need to reduce infection. This is a critical element and driver to decrease infections. For a long period of time, we have gained so much cooperation from general public, and we truly appreciate your efforts. And I know how much reservations you might have had. Many people will be vaccinated and the pandemic started to abate, and people can stay hotels and travel. Up until these effects started to take hold, we would like to pursue what we have to do. On top of that, we continue to bend our ears to what you have to say in a sincere manner.
踏まえ
Given this extension about the job adjustment or subsidies, for July there will be the extension of special measures so that we can protect employment. And as for the Japan Finance Corporation's non-interest and non-collateral interest, for the time being, until the end of the year, there will be the extension, and we will support cash flow of business establishments. And we will keep monitoring and enhancing the monitoring of the variants, India, Pakistan, and from Nepal, about entrance from these nations. So far, 6 days after entry has been the standby period. However, we will enhance, and starting today, it will be extended to 10 days after entry. So we will enhance our border control measures. So effective measures and research have been staged for some areas where containment was successful. In Fukui, in 98% of April COVID positivity patients, they were able to track, and 85% of them were having conversation without any wearing mask when they contracted the virus. So based on that, in bars and restaurants, when conversation is made, we have to make sure that people wear masks so that we can minimize, and they were able to minimize the level of infections. So that way, given such an outcome, including conversation during dinners and meals, wearing a mask and the very basic anti-countermeasures will be effective. So wearing a mask and washing hands and 3 C's aversion, and very basic anti-COVID measures. Or when conversing, it is important to wear a mask. So that has to be something that people have to bear in mind. So that has to be thoroughly implemented. Even for new strains, we have basically the same measures. So prevention has to be done. And towards the containment of the virus, our vaccination program is a key. And around the world, the efficacy of the vaccination program has been evident, and including HCPs across almost all the local municipalities, they were able to start inoculation for the elderly. 400,000 to 500,000 per day has been inoculated so far, and more than 11 million doses have been given so far across different parts of local municipalities in large-scale vaccination sites, and in clinics and other areas there have been vaccinations. And the other day I visited SDF-related large-scale centers. On top of that, in 3 prefectures already they have set up mass vaccination centers. So due to the cooperation of such stakeholders, the majority of the local municipalities across the country by the end of July. They are planning to finish the vaccination program for the elderly. So the municipalities and the healthcare workers, for those people, I really appreciate their efforts. And many medical institutions and vaccination sites have been added. In many prefectures, large vaccination sites have been set up one by one. On top of that, many corporations and J-League and professional baseball facilities and from different universities, there have been a call for offering their sites. As soon as possible, we'd like to make sure that vaccination program is rolled out so that we can combat and beat the virus. And such cooperation is happening across the different parts of the country. I once again would like to extend my wholehearted appreciation for everyone here. On the other hand, in the fields across the board, so there's a lack of vaccinators and premium is needed. Such voice has been heard. So on top of doctors and the nurses, dentists will be vaccinating and paramedics and clinical technicians should be able to vaccinate the shots and pharmacists should be able to cooperate on diagnostics. So as a Japanese government, we'd like to provide support. We'd like to provide financial assistance to the maximum extent towards 1 million shots per day. So we'd like to ramp up the vaccination capacity per day so that the elderly who wants to have the shot will be able to accomplish the program. And by the end of next month, and depending on the booking status, once we have a good prospect for the elderly, so including underlying conditions, patients, and we would like to start the program for the general public.
In your working places and your schools, we start to roll out vaccines and vaccinations, and enough doses have been already secured in this country. By the end of June, 100 million doses have been delivered, and up to September, additional 1 million doses will be delivered at the same time. Olympics and Paralympic Games are the things that people raise concerns and so forth. We need to take it seriously. And we would like to work together with the stakeholders and people concerned so that we have a safe and secure Olympic Games and Paralympic Games, and these measures were underway. Specifically, first of all, the number of people coming to Japan need to be decreased. It used to be 180,000, but it was decreased to 78,000, and that's been more than halved. And we would like to streamline those numbers still. And athletes and stakeholders participating in the games, we have outright testing, and vaccine shots will be delivered. And accommodations, we need to limit those and move scope and the area will be only limited to the exclusive vehicles. And those stakeholders will not be mingled with the general public. If it's a malicious cases, we would like to remove the license to be able to join the participation, and we would like to control them rigorously. And in such a way, we would like to contain an outbreak. IOC, IPC, and Tokyo Organizing Committee, Tokyo government will adjust and coordinate things for Olympic Games, and national government will cooperate well to protect your life. We need to stem the virus, and at the same time, we need to gain traction and gain pace of the vaccination. That's a new challenge. So that as soon as possible, we can go back to safe and secure normalities. We need to get all hands on deck to realize those visions. If we have those unity, undoubtedly we can beat the virus. I'd like to stand at the vanguard of these combat and those challenges, and we would like to follow through those strategies. And once again, here today, I would like to gain your understanding and cooperation for what the national government wants to pursue. I'd like to conclude my remarks. Thank you. With that, I'd like to entertain questions from the floor. I appreciate if Dr. Omi will move to the set position and the Dr. Omi might answer to your questions. If we're appointed by MC, please move to your closest mic and please state your name and affiliation, and please limit your question to one. First, to leading media outlet, Yoshida-san from Kyoto Press.
Kyoto Tsushin, Yoshira, thank you. In Tokyo and Kansai, this is the third time that the state of emergency is in place, and 1 month has been passed since then. So the situation has been prolonged, and once again, there will be extension and re-extension up until June the 20th. How do you see its cause and its reason? And once we have an improvement and once a state of emergency is lifted, is there any possibilities that those areas are migrating to priority measures areas? Through this state of emergency, many prefectures were able to observe the declining trend of new tallies or daily tallies and others, and effects are somehow evident. However, the new cases in Tokyo still are hovering at the level of a state of emergency, level 4, or even higher than level 4 in Osaka. There has been a medical strain. So until it is rectified, it will take some time. Amid such circumstances, highly contagious new strains are also coming up. So we need to consider the impact, and we have to take time so that we can listen to the governor's requests and the opinions of experts. So that way we decided to extend. So first of all, as for the Japanese government, in the areas for state of emergency, in bars and restaurants, and suspension of alcohol serving and karaoke serving and telecommuting, so such measures will be thoroughly implemented. On top of that, regarding what we will do in the future, of course, we have to see the infection status. And upon that juncture, we will make a decision. Dr. Omi, do you have anything to say? Yes. About the re-extension and the reason. So in terms of phenomena, what's happening, it was fully explained by Prime Minister. And regarding the background, what's happening behind the scene, I would say there are three things. Number one, this is the third time of state of emergency, and people are getting used to the situation. So therefore, it is getting difficult to solicit cooperation from the general public, which is a fact. And number two, of course, the impact of variants. Number three, this is where I need to highlight among prefectures about the priority measures and short-term business hours. From study to request to implementation, so it took some period of time. So using this occasion of press conference with Prime Minister, once again, I'd like to reiterate this point. So the issuance process for the priority measures, so it is becoming a heavy process. So therefore, it has to be simplified somehow. So I would say there were three reasons this time.
はい、それでは続きまして。
I would like to move to the next question. Shimizu-san from Tokyo Newspaper.
東京新聞
Shimizu from Tokyo Newspaper, Chunichi Newspaper. My question is on Tokyo Olympic and Paralympic Games. The IOC Mr. Coates had said last week, under the state of emergency declaration, Olympic Games can be held. That's what he said. As the Prime Minister of the host country, do you think it's viable even under the state of emergency declaration? And that's the first question. According to public opinion poll, in summer, a majority of people are objecting having Olympic Games. You are responsible for lives here in this country instead of IOC. You need to be convincing people with in what way you're going to have games, and if in this way you don't have the games, what are the conditions? Could you please disclose them? And sometime in press conferences, your answers were ambiguous. You're not really straightforward, and some Japanese people are struggling to understand what you're trying to say. Well, life and health of Japanese people need to be protected, and that's the first charge of the national government, of course. And I know there are various voices for Olympic Games and Paralympic Games. We need to hear what people have to say, and we are working on what we have to do. First, we want to lift the state of emergency declaration, and then stakeholders' countermeasures need to be implemented so that in a safely the people can participate in the games. This one thing we would like to ensure, and at the same time we would like to protect and safeguard the life and health of people. That's a prerequisite. And given that, there are three specific countermeasures we would like to roll out. First, entrance, specifically the stakeholders. It was used to be 180,000, but 59,000 for Olympic Games and 19,000 for Paralympic Games. So we are streamlining those, and we try to decrease the number furthermore. Next, vaccine. Athletes and stakeholders, and many of them will be vaccinated, and we would like to make sure the vaccine will be penetrating. So from Pfizer, start in Japanese, but athletes, those vaccines will be delivered for free through Pfizer, through IOC. And also contact opportunity with Japanese people need to be protected. And media from foreign countries and stakeholders for games will be managed and controlled by the Tokyo Organizing Committee, and we would like to have a concise area for accommodation. In a set registered accommodations is the only area where they can stay, and anywhere they go will be only possible through only exclusive hire or vehicles, and 2 times pre-arrival and on arrival, and up to 3 days after arrival. Everyone need to take tests every single day, and even after this, on a regular basis, they need to take tests. So these stakeholders and general public shouldn't be mingled. So we would like to segregate those move scope. And you go out and you go around towns. Those are something that we shouldn't allow. So test games has been held 4 times in this country already. And during the games time, if there are malicious cases, we would like to deport them overseas. So I disclose now 3 countermeasures. Tokyo Organizing Committee, Tokyo, and national government have discussed on border control measures. And not only that, as one entity who is responsible for life and health, we would like to pursue the countermeasures. And test game has been held already 4 times here in Japan, and as I said, that's the one element and component we need to pay attention to in preparing for the games.
以外の方から
So now we'd like to take questions from other media outlets, and please raise your hands. So we'll nominate who can ask a question. So please come to the stand stand microphone, and please try to simplify your questions as much as possible so that many people can ask questions. Goto-san is TBS. TBS Goto. I have a question on the Olympics again. With the state of emergency extended, the international society is wondering whether Japan can really host the games. And Prime Minister previously have said there have been specific measures for the Olympics. However, to what extent the infection status domestically should be contained, and how can you explain yourself based on scientific grounds? For example, next month, G7, which will be held in England, there will be a summit, and with each summit leaders, how are you going to explain yourself with such evidence? And for the delivery of the Tokyo Games, about the specific anti-COVID measures, I have already mentioned, and we'd like to thoroughly implement them. And we'd like to thoroughly implement such, and we will not accept foreign spectators. And to the international community, we'd like to explain ourselves and solicit understanding, and for compilation of such policies, the views of the experts have been taken into account. And since September last year, with the TMG and TOCOC, we have had a coordination meeting, and 2 infectious diseases experts have been giving us advice each time, and with transparency in a detail-oriented manner, we'd like to explain our policies.
それでは奥の列から
Misawa-san from Mainichi Broadcasting. Misawa from Mainichi Broadcasting. Prime Minister, thank you. You said you started to see the evidence of a vaccine. For example, in the United Kingdom and Israel, that if the vaccination rate is going up and infection rate is going down, and there is a still, yes, due correlation. For example, half of the Japanese people will be vaccinated. With that in mind, when do you think that vaccination rollout is completed? And you said ambitious target of finishing the elderly vaccination by the end of July. But I want the specific goals for these 50% of Japanese people vaccination. And then in the perspective of herd immunity, how much vaccination rate is needed to decrease outbreak? And I would like to hear what experts have to say. Dr. Omi. Yes. By the end of July, the elderly vaccination program, including second shots, need to be completed. So we would like to gain traction and speed for that vaccination rollouts. And Ministry of Internal Affairs and Communication have reported many municipalities will be able to complete those programs. And sometime next month, once the municipality started to see the good sides of those schedules, including people with underlying diseases, wide array of general public started to be inoculated. That's the desirable plan. And specific timing for that program is in function of vaccination program of the elderly people. We would like to see those development there. But whatever the case is, by rolling out those vaccinations, we can reduce the aggravating risks significantly. And you talked about 50% of Japanese people vaccination. There are 36 million elderly here in Japan. And we need 2 shots, and that needs to be completed by the end of July, as I said. And adding to that, there are mass vaccination centers set up, and many facilities said that they want to do that, and college companies have started to raise their hands and wanting to do those initiatives, and we would like to make it in train. And currently, over 100 million vaccine will be prepared some point in June, and well over 100 million vaccines will be delivered by September. And overseas and other countries put the shots earlier on for first shots, such as 50% of the people were shot just for first time, and many people started to wear off masks. But first, here in Japan, we would like to give the 2 shots for elderly people as soon as possible. And Dr. Omi and experts team have raised those voices, and based on that, we have rolled out those measures. And I would like to hold back saying any details, but elderly people needs to be vaccinated 2 shots. And there are enough doses for that. So let me answer. You talked about herd immunity and by when that we can achieve the herd immunity, you said. Recently, vaccination program rates are high in some countries, and when the vaccination rate is going up and infection curve is started to be flat. But still, the vaccination rate level is still low, and we started to see, it seems like a infection rate, it started to decline. But at the stage about lockdown or right after lockdowns, people started to get those shots, and many people in the country already have contracted the virus of COVID-19. And I don't think we can compare them from an apple-to-apple basis. However, by when we can gain the herd immunity, in the case of Japan, I cannot disclose how much percentage, but as far as this vaccine is concerned, last year that we put a priority and that we made a proposal. This is a prevention for onset of the COVID-19 and also aggravation, and these are the things we discussed last year. But today, I have browsed the data overseas. Then not only prevention for the onset of the COVID-19, but this is the prevention of contracting the virus. And there are experts' voice that the vaccine is contributing to those components. And those of the elderly who want vaccines need to be shot, and after that, the people under 60 years old need to get those shots in their arms. By doing so, we can prevent aggravation for the elderly, but at the same time, more than expected, we can prevent the contracting the virus by those vaccines. Of course, in a flexible manner and agile manner, we need to increase the number of channels for vaccines and vaccination, which is very important, so that we can deliver those vaccines for younger generations so that we can achieve the herd immunity here in Japan, and that's something that's been required. I can't say by when, but if we achieve the 50% of the vaccination rate, then we can start to see there's some impact taking hold. But first, we need to give jabs for younger people at the same time by multiplying the channels for vaccines to get herd immunity. And what seems like a herd immunity to expedite the containing outbreak, and this is the time that's needed for all-out effort in Japan.
Yomiuri newspaper, Kuromi-san. Yomiuri newspaper, Kuromi. I'd like to ask about the vaccination program. So, Prime Minister, like you said before, 1 million shots per day has been your target, and in those vaccination centers, there have been a lot of setup. And when do you think you can exceed 1 million going forward, or reach 1 million going forward? Referring to what's happening overseas, so vaccination is a big program for containing the virus and the infection. So the whole of government approach will be taken for vaccination, and that's actually taking place. And so for vaccination, we have been suffering from the lack of vaccinators. So we have had some bottlenecks, and across the government, with each local municipality, with their support, we are trying to somehow rectify the situation. Right now, per day, 400,000 to 500,000 has been the case. And in June, and after the start of June, and from mid part of that, including vaccinators, 1 million shots will be able to cover it by having the right structure from the mid part of June and onward. At any rate, about these vaccines and the vaccination program, we'd like to do everything that we can do to contain the infections, and I'd like to be at the forefront of this battle against COVID-19 so that the people of Japan can regain and normalize what they are doing and their daily lives.
はい、それでは、奥の、
Alright, Shinohara-san from TV Tokyo.
テレビ東京の篠
Shinohara TV Tokyo. My question is on Olympic Games again. In holding Olympic Games, of course, around the world, tens of thousands of people will come to Japan even though you slush them, and still people will come and flying to Tokyo, and that means the increase in number of traffic if you allow the spectators to come in. And how do you analyze those moves and flows? And what are the countermeasures? I mean, you disclose the countermeasures against the people overseas, but how do you see the countermeasures against the traffic that might increase during the Olympic Games? Well, Japan is under state of emergency declaration in some parts, but baseball, football, under some conditions, they have taken anti-infection measures and they are playing professional games as a reality. Japanese government is watching those moves and a component, and we are learning from them, and we can realize those under some conditions. So what are the capacity for the games? Currently those mass events has a 5,000 even under state of emergency. So with a reference to those various elements and components, various opportunity is possible, and we can respond to those possibilities.
それでは国際メディアから
From international media, Hong Kong Phoenix, Lee-san. Lee Miao from Hong Kong Phoenix TV about the new entrants from foreign countries. Currently, Japan, from almost all the parts of the world, new entrant is not allowed. However, for example, in China and in many foreign nations, there are many who want to live and study in Japan. And amid such circumstances, there are some areas where vaccination is having a progress. And for example, for vaccinated people, do you consider vaccination a passport program so that you can prioritize the entry of those people? Is that any option? If that is realized, and at what time period do you think it can be implemented? Yes, so-called vaccine passport implementation in overseas nations, various discussions are taking place and movements as well, which I know. However, for introducing such a program, whether it is effective for containing the infection and the sustainability of the efficacy, there has to be a scientific evidence and evaluation. And there shouldn't be any discrimination against the non-vaccinated people as well. So there are various views associated with this discussion. So therefore, under Chief Cabinet Secretary, across the government, the coordination is going on across the board and at home and abroad. We'd like to see discussions and the status in each country. We try to collate all the data to study this matter.
NHK の長内さん。
Then Osanai-san from NHK. NHK, this is Osanai. This is a question to Prime Minister. You talked about vaccines impacts. 20th of June is the end date for state of emergency, and when you consider that schedule, have you baked into the progress for vaccination? And if that's the case, vaccination rates or the number of cases, what are the guiding indices you have in your mind? Thank you. Well, in lifting state of emergency declaration, that's been stipulated in the basic policies. Infection status and how strict the medical readinesses are. These are the basis, and at the same time, experts' opinion are the basis for making a call. Specifically, state of emergency declaration level, that is a stage 4. We need to exit from the stage to go to stage 3. That's the one index we need to watch. And vaccination progress has not been set as a standard for lifting state of emergency. However, if we make a good progress for vaccination, new infections and the medical readiness stretch will be decreasing. That's what we expect. Therefore, we would like to gain speed and pace for vaccination rollouts, and that's an environment we would like to put in place. Dr. Omi, would you like to give us any comments? Well, whether or not we baked into the vaccination progress into that state of emergency declaration, I don't think we should replace those indices. But once the vaccination rollout is advancing, it's much easier facility for us to lift the state of emergency. For example, elderly people started to get those jobs, and that will prevent the aggravation of COVID-19 for the elderly, and we see the less number of criticals and the less hospitalized. So even though we have a mass number of infections, we can reduce and alleviate the burden for medical readinesses or capacity. So the conditions for lifting state of emergency is the area we can reach faster, and it's much easier to prevent those. And once we started to see the effect for prevention of the elderly, again, I repeat myself, but we can reduce the burden for medical readinesses. And in lifting state of emergency, we need to prioritize how strict those medical readinesses are. So it's much easier to lift the state of emergency declaration in much earlier on.
はい、
Now, Fuji TV Kashima-san. Fuji TV Kashima. About vaccination and wearing a mask. The correlation in between, I have a question. The other day, a South Korean government, so the people who got vaccinated for the first time, for one time, outdoor, people don't have to wear a mask. And so that was announced as a duty lifting. And of course, that depends on regions and countries. However, as a Japanese government, do you have any policies that you have in mind for not wearing a mask once there is a vaccination program progressing? Or do you think it's too early? And how do you see the correlation between vaccination and social activities? About this vaccination, the onset and complication risks can be alleviated, and prevention. On these fronts, there are some effects. That is the expectation. On the other hand, regarding the infection containing effect, there are some researches which came up. However, it's not crystal clear yet. And about wearing a mask, like I said in the beginning in my speech, in Fukui, according to what they researched about. So 85% out of traceable cases, they were not wearing a mask when conversing. So that was attributable. So even people who got vaccinated, including wearing a mask, anti-infection measures, wearing a mask, and washing your hands, and operating 3 Cs. At this point of time, I myself would say that these are necessary measures, but in foreign countries, through vaccination program, social and economic activities are now up and running in some areas. As Dr. Omi has said, there was a lockdown. However, regardless of lockdown, some of them couldn't contain the virus. However, vaccination turns out to be effective. At any rate, we are taking every measure towards a vaccination rollout, and there will be good progress going forward. At this point of time, we'd like to listen to opinions of experts before exercising our decision.
それではブルームバーグの信弘さん。
And Nobuhiro-san from Bloomberg.
ブルームバーグの
Nobuhiro from Bloomberg. Present. When we think about economy after COVID-19, people are concerned about semiconductors. This is a question to Prime Minister, and we are short on semiconductors, and this is impacting the production of cars. As a central government, how do you secure these semiconductors, and what are the strategy would you like to roll out? Thank you. Well, we are seeing the advancing digitalization and cars and home appliances and PCs. These are using semiconductors, and this is undergirding the economy, and semiconductors is so important component, and this is driving the competitive edge, and this is starting to be firm and resilient for supply chain, and in order to grow the economy. The semiconductors capability need to be secured in Japan, and we need to ramp up our competitive edge, and this requires an all-out effort in this government. At the moment, semiconductor strategy is being formulated. Technological advancement supports so far, but not only that, the various policies were considered, and that's been underway in the ruling party's discussions. So based on which the growth strategy will be formulated, and with a reference to that as a one key component.
それ
Nikkei newspaper, Shigeta-san. Nihon Keizai newspaper, Shigeta, about vaccination program. The other day, Japanese Pharmacies Association chair, you had a meeting, and what is the possibility of a pharmacist serving as vaccinators, and dentists and paramedics being vaccinators? There are some borders in terms of legality, and it will take some more time. So, about the vaccination program, and so you pointed out the need for legislation establishment, and how do you see the revision of some medical act or physicians act currently in order to expedite the vaccination program? So-called healthcare professionals, we have to secure them, and we have to seek all available means of ramping up vaccinators. Dentists, with these people, now we are asking them to give a shot. On top of that, clinical technicians and paramedics, on a day-to-day basis, they are involved in using injection tools. So therefore, these technicians and the paramedics We are now trying to ask them, and we started our coordination. And about the pharmacists, in foreign nations, from normal time, there are some countries where vaccination is conducted by these people, which is not the case here in Japan. So therefore, in advance, so we have to provide some steps for them to be able to provide a vaccination. And now a pre-examination is taking a lot of time right now. So therefore, pre-examination has to be well organized in advance. And they are experts on a different kind of medications. So in order for doctors to be able to exercise a swift decision, they might be able to cooperate over pre-examination. So there are many different formats. So we'd like to ask their cooperation.
それでは大変恐縮ですが、
I'm afraid the next two questions will be the final one. And Ninoma-san from Nishi Nippon Newspaper.
西日本新聞の米という
Ninoma from Nishi Nippon Newspaper. You talked about, Prime Minister, that this declaration will be the final one. These are the things that you have said before, but you didn't say it today. But you have repeated extending state of emergency. This has been driving the notion that people started to see them as a routine. With enhanced measures, do you think that it's possible to decrease the contact and traffic? And you haven't touched those. And do you think really you can lift the state of emergency in the 20th of June? And are you ready and are you committed to lift the state of emergency by then? And don't you think you need much powerful measure to do that? And this is a question to Prime Minister and Dr. Omi. Thank you. Well, first let me answer. There are threats of variants and that we have elongated period for state of emergency. Some of you were exhausted and you started to see them as a routine. And we need to, of course, think about them. And we need to be selective in effective measures and having taken those actions. Especially dining moments and scenes are the focused area. That's what the experts have told us. Therefore, that's the focused area so far. And this time, the trump card for challenge against the COVID-19, that's a vaccine. Therefore, this job rollout is something we need to give priority, and at the same time we need to contain outbreak as we have done so far, so that we can stem the outbreak and we can stem the spread of the virus. Unlike in the past, we have additional tool that is vaccine to combat against COVID-19. That's a different scene we haven't seen before. So we need to communicate to that general public to facilitate the vaccination program, and we are doing all out for that vision. And 11 million or more people were getting jobs already, and many more people are applying for the vaccines. For example, companies and schools and neighborhood of companies started to raise hands and wanting those vaccination centers. And as I said in the remarks at the outset, many more local governments are raising hands in such a way. So we would like to contain outbreak with the two weapons in our hands. Well, let me answer on whether or not we need to restrain the people's moves. I guess that was your question. With the variants in the scene, we are confronting new challenge in this Japan's community. An impact of a state of emergency doesn't really take hold. Tokyo is under state of emergency, but still, the traffic started to climb. So we need to think about what to do. There are two aspects. One, we are hoping for behavioral change of general public. We just call out staying at home in the past. Of course, general public, we need to cooperate staying at home because it's a critical moment. And this is not just about call on cooperation, but we need to give a convincing anti-infection measures. In other words, we need to combat against the variants, and ventilation has been very important to date. And in that, CO2 sensor need to be installed, and CO2 concentration can be measured in those establishments. And once the restaurants install them, some people will go and visit those restaurants. In such a convincing way, we need to have people change their behaviors. And as a second aspect, of course, we do need cooperation from general public, but national governments and local governments cannot just wish, but we need to get full capitalize on the technology, cutting edge technology. One is vaccine, needless to say, and secondly, and antigen test kits, and these are full rich portfolio. So strategically, we need to resort to those technology. And one more technology is a digital one. As a matter of fact, we want to contain the infection to 100 or 50, but it's not so easy way out. Why? Because I have said since last year, some prefectures have done proactive epidemiological investigation to be identified who contracted the virus and where, but that's not been necessarily been the case in some prefectures. Because we cannot necessarily get a grip on where the virus is expanding. And without noticingly, the virus is traveling to the other cases and other places. And of course, that's been the driver for the fatigue of our health centers. And QR code can be set up, and that's one tool we tried to leverage, but that failed. But here today, for example, QR code will be set up in restaurants, and the people can touch the QR code in visiting the stores, and in case the outbreak occurs, we know who contracted the virus and where without disclosing the specific names. Without knowing those information, we cannot anyway reduce the infection level to that low level. So testing and digital IT technology is the one thing we need to leverage at the fullest to get to know where the virus is living. And that's the sharing strategy we need to pursue with the local governments. We have said this for a whole year, but that has fallen down with many reasons. But with the vaccination rollouts, we need to pursue this tool, which will be resolving the current state challenge.
Okay, Asahi News. Asahi Shimbun Newspaper Japan, Izuka-san. At this point of time, including Tokyo, in many schools, so there are plans for students to view the Olympic Games, and under COVID-19, many students are participating as a school events. What will be the risks or the significance? What is your input, Prime Minister? About Tokyo's students viewing the program. And before the expansion of COVID-19, organizing committee recruited the applicants. And what to do with this program is currently being considered. At any rate, the infection status and based on the measures within the organizing committee, there has to be a decision. At any rate, the school activities, this is going to be extracurricular activities. under COVID-19. So basic response policy will be taken into account, and the education board's committee will be exercising a decision for this matter within each prefecture, and safety and security of children have to be protected as the first priority. I think that's my expectation. That's my hope. Thank you. So people who are raising their hands, I'm so sorry. However, please give us an email with one question later on in writing. So will be Prime Minister's answers, which will be published over their website. Thank you very much for your understanding. With this, we'd like to conclude today's press conference. Once again, thank you very much for your cooperation.